Have you heard of diverticular disease? Diverticular disease occurs when small sac-like outpouches form on the lining of the colon that balloon through its outer wall, kind of like a pouch or a cave. A person may have one diverticulum or multiple diverticula that increase in size and number as time passes, but are usually less than 1 centimeter. In the colon, diverticula mainly develop in the sigmoid in Western populations. Researchers are unsure what the cause of diverticular disease is. However, it is more common than those who consume insufficient fiber. It is thought to form from high pressures generated inside the lumen that pushes the walls so that they bubble out between muscle bundles and form pouches. This could be because the colon is strained during constipation or from smooth muscle contractions during food digestion. These pressures usually occur where the lumen is smallest in diameter, as the walls get pushed on the hardest, such as the sigmoid colon or where blood vessels penetrate the muscle layer. Diverticular disease is an umbrella term encompassing both asymptomatic and symptomatic conditions. The most common diverticulosis is usually asymptomatic, and patients usually don't know they have it. Here, outpouchings can take two forms. In true, all the layers of the colon walls are involved in the outpouching, and this is a congenital problem occurring in infants. In the more common false or pseudodiverticular, the muscle layer remains, and only the mucosa and serosa layer are involved in the outpouching. This is termed acquired diverticulum because it occurs in adults. Sometimes stomach pain and occasional bleeding are also experienced. Large amounts of dark red blood is passed through your stool because the outpouchings cause blood vessels that supply the colon to weaken and rupture. The diverticula of 10 to 25% of people become inflamed, resulting in diverticulitis, another presentation of diverticular disease. Patients may experience intense pain or tenderness in the left lower stomach, usually where the sigmoid colon would be, nausea, fever, tachycardia, diarrhea, cramping, bowel irritability, and bloating. It is thought to be caused by microflora or feces. Lodged fecal can block the site of outpouchings, causing inflammation and often ischemia, a reduced blood supply to the colon. Or it can be due to the gut bacteria that lives in the colon and initiates an inflammatory response. Risk factors for diverticular disease include older age. More than 65% of those aged 85 and older have diverticular disease. Being male, low-fiber diets, obesity, specific medications such as aspirin, corticosteroids, smoking, and a lack of exercise. Treatment of diverticular disease can be either medical or surgical. Medical treatment looks at ensuring a high-fiber diet and plenty of water. If symptoms progress or diverticulitis is acquired, IV antibiotics, analgesic fluids, antispasmodics, and rest may be necessary. Additionally, diverticulitis requires a different diet of restricted fiber and liquids only. Secondly, for surgical intervention, you might need a segmental colectomy, a resection. Complications are an indication that surgery is required and include perforation of a diverticulum. This could lead to the formation of a fistula with the urinary bladder. A fistula is a tunnel formed by two hollow organs, and this can cause signs and symptoms as the bacteria that normally lives in the colon can go into the bladder, causing UTI and release gas, resulting in bubbles in the urine. Persistent inflammation that fails to respond to medical treatment, diverticulitis, undrainable abscesses that are formed. Diverticula form but don't disappear, so it is best to prevent the disease from developing or progressing by following a well-balanced diet of high fiber content and adequate fluid intake and staying physically active. By making these changes, you may be able to live symptom-free with diverticular disease or reduce its progression.